my screen. So we're going to go ahead and jump into this week's material. What we're going to do here is we're going to go over the preschool child. We're going to watch a quick video. We're going to talk about a couple theorists, and then we'll do the school age child. You guys will take a break. We'll do adolescence. We'll do a Kahoot. And then you guys will take your quiz, and then class will be over. At any point in time, if you have any questions, please let me know. So we're going to go ahead and jump into this week's material. So the preschool age kid, who can tell me, what do you think? Which stage per Erickson is a preschooler in?
3 to 5 years.
Yep, 3 to 5. And so Eric starts trust versus mistrust is the baby. The toddler is autonomy versus shame and doubt. What stage for Erickson is the preschooler? So it would be the 3rd stage for Erickson.
Initiative versus guilt.
Initiative versus guilt. Very, very good. So this is the time in life when what you're trying to do as a parent is instill a sense of initiative. You want them to want to try new things. So you expose them to things that they're potentially going to be good at and that they can do, so that then they feel like they're good at things, and then they want to keep trying new things. So this age group is, generally 3 to 5, 3 to 6. They have a lot more control of their muscles. They're able to do a lot more. So they're not like a toddler that kind of falls or waddles or has an unsteady gait. They can really jump and skip and run. And they just kind of keep getting more and more coordinated. They should have, you're going to notice if they're right-handed or left-handed, usually by the time they're about 3. And they should have their primary teeth. So, they should be able to eat normally. All of their baby teeth should be in. So Piaget, is a theorist that really focuses on cognition. So his stage for the preschool years is pre-operational. So the first stage for Piaget is sensory motor. That's the baby. But the preschooler is going to be in the pre-operational stage for Piaget. And Piaget actually divides the pre-operational phase into 2 stages, the preconceptual and then the intuitive thought. So preconceptual is going to be that younger, 2 to 4. So kind of the beginning of that not being a toddler. And this preconceptual is just a lot of language development. This is the time in life when you really think kids are going to really expand their vocabulary quickly. And then the intuitive thought comes later, 5 to 7. So the intuitive thought has a lot to do with like imagination. They just view the world differently. They're not very logical at all. So I don't know if you've ever known like a 5-year-old, but they don't really think about cause and effect very much. They think that non-human objects have human characteristics. So an example of that, these are some terms that I know you need to know. So animism is common in this age group, this 5 to 7, and that's the belief that inanimate objects have human feelings and intentions. So this is like your teddy bear is your friend, or believing that when God is angry, he yells and that's why it's windy outside. So there's just this belief that non-human characteristics can be given to human characteristics are given to inanimate objects. And I'm sorry, I melded animism and artificialism, but they're very similar. So animism is like a toy that has human characteristics, and then artificialism is environmental things. The wind, the rain, etc., is caused by some sort of human characteristics. So this sort of imagination is common in this age group. This is the age group where they really have a lot of imaginary friends. So, and they're not logical, and they're really not very good at math. They just don't have those cognitive skills yet. So, so they're also still really kind of focused on the here and now. So if you're ever thinking about like teaching a preschool child, you can't tell them weeks in advance that they're going to have surgery, because they just don't understand that yet. They're really still thinking about what's happening right now in their life. And they, like I said, they're still not very logical, etc. So we talked about this last week. If you have a kid that's not, behaving the way that you expect a kid to behave, not having the milestones either cognitively or physically, then you need to start thinking about, is there something psychologically going on? Is there a hearing problem? Do they have ADHD? Is there something going on at home? So just being aware of that, it's not just noting that they don't have the language skills that you expect, but then doing a deeper dive and trying to figure out why. And it could be something as simple as they have a hearing problem, or it could be something more complex like mom or dad has a drug addiction problem and they're not really getting the care that they need at home. So always just thinking about, where your kid is developing and trying to figure out if they're not hitting those milestones, what's going on, that you should intervene as a nurse. So one of the things that parents struggle a lot with is a bedtime. So I don't know if there are any parents in the room, but generally speaking, kids hate to go to bed. So what are some things you can do to teach parents how to sort of make going to bed easier with your preschooler and toddler? What are some tips?
Implement a bedtime routine.
Okay, so implement a bedtime routine. So tell me more, like what sorts of things would you include in a bedtime routine?
Like with my children, we have wind down time. All devices have to be turned into me and plugged up.
Okay,
Like an hour before bed.
okay, yeah,
I make them get like all their stuff ready for the next day. It's just little things that we do leading up to bed, and that kind of
okay.
cues to them that the next phase is to go to bed.
Okay, very good. And that's exactly what we recommend. You don't want to like be on your screen on your iPad or watching TV right before you go to bed. You certainly, if at all possible, not have the TV in the room. You don't want to be going to sleep in front of the TV because it's harder to really get a good night's sleep. And like maybe a bedtime story, like whatever your routine is, a little kid might be like, we're turning all the electronics off. You're going to take a bath. You're going to brush your teeth. Then we're going to have a story. And then after the story, it's time to go to sleep. And you really do the same thing every night. So then they get in the habit that after this activity, then I'm just going to go to sleep. And if you have those boundaries and you have those rules, it just makes life so much better going forward because they're going to learn to respect those boundaries and it's going to be easier to parent them as they grow older. So thank you for sharing. That's the basic thing that we focus on is having a bedtime routine and having them quiet down before they go to bed. And this whole thing with kids are like, I'm hungry, I'm thirsty, I'm hot, I'm cold, whatever. You don't want to give into that sort of, so you want to be positive. Good job for lying down. But if they do that attention seeking behavior, you want to be like, no, it's lights out time. We're not having a conversation about the fact that you're hungry. So that is like a key point. We're also going to do some more information later on and some other things that parents really struggle with in this age group. But something that's really important to remember as a nurse is that like play is the work of children. So they need to play in order to develop normally. And there's like a certain process that they go through in terms of how they learn to play. So they start with parallel play, which is when two toddlers are like near each other, but they're not interacting at all. And then associative play, they're playing with the same thing, like maybe they have blocks and they're building a tower together. And the cooperative play is they're like really engaging with each other, maybe with a board game or a game that has a common goal, and they're working with each other to accomplish those goals. So those the sort of the steps that they go through normally when they're playing. And so when you're observing children, you should observe whether or not they're playing and whether or not they interact with other children. One thing that's true about this age group is they really like to help with household chores. So that's one of the things that you can do that's like a positive reinforcement. Ask them to, put the clothes in the dryer or ask them to help wipe down the table or something like that. And then really give them praise when they do what you ask them to do. And something that's sort of unique in this age group is they're really afraid of bodily harm. So if they're ever in the hospital for whatever reason, if they have like a fracture or they fell and they hurt themselves, they're like worried that they're going to get like an amputation or something terrible is going to happen. So they have this sort of unnatural fear of bodily harm that you need to remember when you're talking to them about any medical procedures. So just kind of think about as kids kind of move through this preschool year, they're getting more coordinated. They're able to do more and more things. Their vocabulary is continuing to expand. And then they start also like 4-year-olds, they're still kind of with the talking with the simple plots, and you're going to see as they get older and older, then they're going to start wanting to talk more, and they ask more and more questions. They just kind of continue to develop cognitively and physically. Certain things that you should think about, like a 5-year-old really should be able to ride a tricycle. So, if they're not, that's something you to make a note of and question. And this is, 4, they're still kind of in that simple plot, not very complex stories. And now they're starting to talk a lot more at age 5. They're asking more and more questions. They might be able to do some like basic computer games and things like that. And we talked about this. You always want to do positive reinforcement, not negative reinforcement, 1 minute per year and age for your timeout. So thumb sucking, this is so bedtime and thumb sucking, and then we'll get to bedwetting in a little bit. So thumb sucking is something that parents worry about a lot. So what do you think if your kid's like 4 and they suck their thumb when they're stressed out? Is that a problem? Is that something that you need to worry about as a parent?
Isn't that's the way they soothe themselves though, right?
Yeah, there's still that oral, they still have that oral soothing. So it's still, from back when they were little, that was like that primitive reflex of sucking was something that was good. They would help calm them down, and so it's a normal calming reflex. So as long as they don't have their permanent teeth in, if it's just their baby teeth, it's really not a problem, because they're going to lose those teeth anyway, and it's not going to affect how their permanent teeth come in. So the main thing that we tell parents, if they're under the age of 6, because you really kind of expect their permanent teeth to start coming in around age 6, it's not a problem. And you should give them positive reinforcement if they try to not suck their thumb, if they have some sort of other coping mechanism. But you never want to do anything like put hot sauce on their thumb or spank them if they suck their thumb. It's kind of one of those things that almost all children outgrow it by the time they start like 1st grade. So if they do it occasionally when they're stressed out, it's not a big deal. And you want to kind of let parents know that it's normal, so they don't think there's something wrong with their kid if they're still sucking their thumb at that age. So bedwetting, has anyone ever had a kid that wet their bed when they were like 3, 4?
Yes. I
Yes.
did.
Okay. What sorts of things normally prompt kids to wet their bed?
One of them is being scared of the dark.
Yeah, stress or being scared of the dark. Yeah. So the medical term for bedwetting is enuresis. So it's 2 categories. Primary is the kid has never been able to stay dry, and the secondary is that they didn't wet the bed for a year, and then they started wetting the bed again. And it's more common in boys than in girls. And sometimes it's totally normal. Sometimes it's just like you're stressed, maybe you moved, you're on vacation, you're in the hotel, it's a strange place to sleep. There could be something like temporary going on in their life that causes them to be stressed out and wet the bed. Or there could be a problem. They could have a urinary tract infection. They could have diabetes. Maybe they're having seizures that happen when they're sleeping, and they urinate when they're having a seizure. There could be something wrong with their urinary tract. So even though it's common and a lot of kids wet the bed, you still need to be thinking about, well, is there something else going on here that I need to worry about? So there's a lot of questions that you're going to ask, like, is it, when do they wet their bed? How many times a week does that happen? Are they also peeing too much during the day? Is this like a kid that pees a lot? That would be more concerning for diabetes. What does the urine stream look like? Is it a normal stream? Is it like concentrated? Is it painful when they pee? Also thinking about, do they drink a lot between bed and eating dinner? Like, are they getting too much fluid right before they go to sleep? Is there any sort of family history? What are their medications? What's their sort of history with toilet training? So with bedwetting, it's a little bit different than thumb sucking, in the sense that thumb sucking, it's probably fine. There's really not the, you worry about, they'll probably outgrow it. With bedwetting, if it's happening, more than just occasionally, and there's not like a definitive stressful thing that's happening that causes them to wet the bed, there really needs to be a lot more of an investigation to make sure there's not something else going on. So there are like bedwetting management programs. So there's like hypnosis and behavior modification, bladder training exercise. Sometimes there's medications that help if they have like bladder spasms. So just to be aware, you always want the kid to be at the center of that program and to be like the main focus of the treatment to stop the bedwetting. So what do you guys think about preschool? Would you recommend parents put their kids in preschool? Do you think it's good or bad?
I think it's
I
good.
think children need to go to preschool. They need to
Social.
be the kids' age, learn how to interact. I agree.
Okay. So they learn to interact. They learn some like social rules, right? They, following, we go to lunch at this time, we go to recess at this time, just kind of being in a group. And sometimes they learn some skills that they're going to need for school. What are some downsides to going to preschool? Like what's something that might happen that might stress parents out?
They get
Probably
sick a
Spreading
lot.
germs.
Yeah, exactly. Kids are, they're always a lot of times right when they start school, they have lots of respiratory infections, etc. They spread germs a lot. So that's the main downside, but there's a lot of benefits to preschool. So if you ever have a parent ask you if they should put their kid in preschool, the answer should be yes. They really they get a head start in terms of doing well in school if they go to a good preschool program. So just, I'm sure some of this with the development is kind of logical. Like obviously, as you're growing and you're progressing through the preschool years, you don't need as much attention from your parents. You still need to be supervised around pools and around things that are hot and not touching the hot stove, etc. But they're able to do a lot more. You should be making sure that they're wearing clothes that are comfortable, that they're able to play and jump with their friends. So accidents can still happen, and in fact, the more mobile they are, the risk goes up. So thinking about all the things that kids get into in this age group and making sure they're getting the appropriate level of supervision. They're still the age where they might try to take pills or whatever. So making sure that your medications are locked up, that they don't have access to them. And starting to get into some information about like not talking to strangers, not approaching anyone's car that they don't know. They're more independent, but they don't really have good judgment. So even if you're not like, hovering over them the way that you would a baby, you still need to be supervising them. And we talked about this. It's normal for them to have imaginary friends. It's nothing for you to worry about. And so it's part of their cognitive development at this stage. So this concept of separation anxiety, we talk about it in this class with regards specifically to like hospitalization. So you have a kid in the hospital and then mom and dad have to go to work, and how is that child going to respond to being left by their parents? So this is week 3 discussion post is on the separation anxiety, and it's also on exam 1, which is the same week. So I'm sorry, not week 3, week 4. So it's kind of one of those things that I know that it's going to be on your exam 1, but we also you're not going to write about it for your discussion post until the same week of the exam. So I just want to point it out that it's something that you need to know, and you need to sort of recognize what's going on. So it's really 3 stages: protest, despair, and detachment. So the general idea is that the kid comes into the hospital and mom and dad leave, and the kid freaks out, cries out all the time, upset that mom and dad isn't there. And then despair kind of kicks in, where they don't want to interact. They're just sad but they're not crying out. They're just kind of depressed. And then detachment is like, they're going to play with their toys and they're going to kind of like suck it up and kind of get over the fact, or pretend like they're over the fact that they were left. And then mom and dad come in and they won't interact with their parents. They're going to sit there and play with their toy and not interact with their mom and dad, which can be hard for their parents because obviously they miss their kid. So this is just, the protest, despair, detachment is kind of like the normal process that kids go through when they're left by their parents. And then, you need to think about what you would do in this situation as a nurse. So if they're really, really upset, maybe you're going to try to distract them in that protest stage. In the despair stage, let them be sad and kind of still kind of offer them some activities. And then in detachment stage, if the parents are upset, you can be like, hey, this is really normal. She's just trying to cope with the fact that she was left, and you should still come here and spend as much time as possible. So this is going to be in your textbook, and it's also going to be one of your discussion points. And I just want to point out that it is definitely on your exam number 1. So this is kind of getting back to, as a nurse, you're going to be observing your patient and thinking about how they play, how they interact with others, how they talk, and you're going to gain a lot of information based on your observations about how they're developing, etc. Do you guys have any questions about the first bit of information about the preschool years?
No.
Perfect. So we are going to move on. We're going to do a little bit. We're going to do another video. This one is on Piaget's theory, and then we're going to talk about Kohlberg really quick. Let me pull up your video link.
Now, the NCLEX and most exams will test your knowledge on this theory by asking you how to teach a child. So if you get a pediatric teaching question, they're really just testing you on the knowledge of Piaget's theory. So Piaget's theory is 4 stages of thinking. Be sure to write this down. So first stage is 0 to 2 years old. We call this the infant and toddler stage. So the stage is sensory motor. The child thinks in the present moment, senses, and not past or future, as mentioned by Hesse. Another main characteristic of the stage is object permanence, where objects are still there even if you can't see it, like playing peekaboo. For example, covering a toy with a blanket and uncovering it, kind of like peekaboo or Jack in the Box toy. So that's why this type of toy is the best for this age group. But we're going to cover that in the play segment. Now, as far as teaching, be sure to write this down. We always teach in the present moment. That is huge. So teach them what you are doing while you are doing it in the present moment. Now, as far as pre-procedure teaching, this is mainly for the parents and not for the child. So, for example, Foley catheter insertion for an 18-month-old child. Teach the child what you are doing as you are doing it in the present moment. Now, the next age is 3 to 6-year-olds. These are our preschoolers. This stage is defined as pre-operational thinking. Pre-operational thinking or preschoolers. They're very imaginative as well as symbolic thought with magical thinking. They do not understand cause and effect. For example, scraping their knee was caused by earlier misbehavior. They understand the future and the past. Now, a little side note here. Another big example on most exams is if the child is adopted and finds out that they're adopted at this age. They often feel responsible for being adopted and find it difficult to understand, often thinking it's their fault since they don't understand cause and effect. So trust me, this was a big one on the end. Now, in terms of teaching, the child shortly before a procedure. Teach them the day of, the morning of, or even a few hours before here. For example, a Foley catheter insertion for a 4-year-old child. Teach the child what you are going to do. The key word there is what you're going to do. Now, the next age is 7 to 11-year-olds. This is our skill learning stage. Now, it's characterized as concrete operational thinking. So these children have logical thoughts, they follow rules, and have rigid thinking. So there's only one way to do something, as mentioned by ATI, and it's defined as limited abstract thoughts, as mentioned by Hesse. So for the memory trick, Just think 7-Eleven mini marts. They have a bunch of concrete all around the mini mart. There's no trees or grass. So concrete thinking is between 7 and 11, like the 7-Eleven mini marts. Now, in terms of teaching, we always teach the day before a procedure, and we include skills like insulin injections. So we show demonstration and often provide reading. So for example, teach them tomorrow we will, or you will do this every day. Another example here, which child can the nurse teach bandage placement skills? 7-year-old and up. Now, finally, our last age group here is 12 to 15-year-olds. These are adolescents, defined as adult learners. So the stage here is formal operational. They're developing abstract thought. Be sure to write that down. Abstract thought is what they're mastering. Basically, cause and effect thinking. For example, love, hate, and morality. And in terms of teaching here, we teach them like an adult. Again, be sure to write that down. We teach them like an adult. It's basically med surg style. So remember, 12 years and plus, or 12 years and up, they can manage their own care. So teach them, report these findings, or if you see this, follow up with your provider. And another example here, which child can manage their own care? The key term there is manage their own care, just like an adult. 14-year-old with diabetes mellitus type 1. Now, a big NCLEX tip to write down. Risk-taking behavior. They're very non-compliant here. So this age group, be sure to write this down. They're just like adults. They're risk-taking and they're non-compliant, especially our diabetic patients. Okay, now you're probably asking yourself, what do you mean by risk-taking?
Okay, Denise told me that the volume was low. Were you guys able to hear the video? You were. Okay. So I like the videos because I think that it breaks it up and then it makes it easier to pay attention. So he kind of does a good job of like kind of pointing out a lot of the test taking questions that you're going to be asked are going to be applying the theory, right? It's not just going to ask you. So thinking about how that stage of development would influence how you would teach them at that specific age. So there's another theorist that we're going to talk about here. It's called Kohlberg. Did anyone read about Kohlberg in the textbook? What can you tell me about Kohlberg?
Not much.
I think he crazy.
You think he's crazy? Okay. What does Kohlberg focus on? Is he a what does he think is going on? What is he talking about? Is it cognitive development? What type of development is he talking about? Moral
Moral.
development.
It's too
So
much.
I agree with you too. I think he's crazy.
oh, you think okay, fair enough. I'm sorry here. I thought that I had put everything right where I needed it, and then I'm not finding what I needed. So give me just a second, and I'll pull up a brief little snippet of Kohlberg. Not sure where my picture went. So yes, the Kohlberg is the moral theorist, and he starts out by saying that children do like their first stage of moral development is that they do something because they are afraid of being punished, and that from there they start to develop a more advanced sense of morality. So it starts with like, I just don't want to get punished, and then it goes on to what's in it for me, like if I do the right thing or if I report something, is it going to benefit me? And then it moves on to, well, I want to be viewed as being a good kid or a bad good kid, following the social norms. And then after that it kind of moves on into more of a sense of morality. So I'm going to pull up a picture here that has the ages that makes it a little bit easier to understand. But that's the basic concept of Kohlberg, is that you really starts with just a desire to not get punished, and then from there it moves on to more complex theories or more complex thought process. Let me see here. Okay. grab it here. Minimize this one. Okay, so you'll see here in the beginning, we're talking, early on infancy, they don't really have a moral compass. It's just 100% avoiding punishment. And then they start moving on to, they're going to start school, the preschool years. They're thinking about themselves a little bit more. And if they do the right thing, does that benefit them? And then once they're school age, they're more thinking about like, how am I going to be viewed by my peers? Am I going to be viewed as a good kid, bad kid? They're kind of also in the same sort of age group. They're very concrete and fixed in their why they follow rules. And then they kind of move on as they get into teens and adulthood in terms of being more concerned about whether it's right or wrong and the ethics of the dilemma. The only thing that I will say about Kohlberg is that, this whole fear of being punishment, it never goes away, right? Like you could be 30 and really want
You're
to drive
constantly
fast,
getting punished. Yeah.
but you still follow the rules because you don't want to get punished. So even though it builds on it builds on itself and you develop other layers that influence what decisions you make when there's an ethical dilemma, that fear of being punished kind of sticks with you and it never goes away. So that's the basic concept of Kohlberg. Do you guys have any questions about that? He's in your PowerPoint, he's in your book. Okay. So we're going to go ahead and move on to the next age group here. Let me pull up your next PowerPoint. We're going to talk about school age. All right, so the school age child. So this is going to be your 6 to 12-year-old. So we talked about in the preschool, they have like a lot of imaginary friends. They don't really have imaginary friends by the time they're school age, but they're still into things that are magical. They like stories about witches and dragons and fairies, etc. This is really the age group where they have their first really close friends. I don't know, most of you probably remember being school age and you had like a best friend. They start being concerned about being judged by their performance. And it has here a sense of industry and development of positive self-esteem directly influenced by their group. So what Erickson theory or what Erickson stage is a preschool? So we said infants are trust versus mistrust, toddlers are autonomy versus shame and doubt, preschoolers are initiative versus guilt, and then school age, what are school age? Stage 4 for Erickson.
Industrial versus inferior.
Yeah, so this is that word in industry, right? So this is where you want them to feel like they're industrious. They want, so the negative thing that could happen during the school age year is that they develop a sense of inferiority and they develop a low self-esteem. And the positive thing is that they develop a high self-esteem and a sense of industry. So this is just kind of focusing on kind of what you want kids to be doing in this age group and always targeting your interventions as a parent or as a caregiver towards helping them develop that self-esteem and that sense of industry. So they continue to develop. So there's a lot of language development in the preschool toddler years, but now they're moving more into understanding. So not only are they able to write, but they're understanding what they're writing. And this is going back to this Erickson thing that parents need to be guided to understand them that multiple unsuccessful experiences can lead to the fear of trying. So constantly exposing them to new things, but things that they can be good at. And then really praising them when they succeed and then keeping them engaged and offering them new activities. So this is really the stage where you really want them to develop that self-esteem and industry. So here we go. Your classmate knew this. This is your industry versus inferiority. And Freud is the sexual latency. So in the sexual latency stage, according to Freud, they're not interested really in the opposite gender. This is this age group where you tend to see like the girls hanging out with the girls and the boys hanging out with the boys, and they don't really play with each other very much. And then for Piaget, this is the concrete operations. So concrete operations, they're starting to get better at math. They're starting to understand math skills, but they are very logical and linear. They're starting to understand cause and effect, but they're not really understanding abstract thoughts yet. So they're developing, getting better and better at math, but they still don't really have, planning for the future or abstract thoughts. And this thing is this is part of that math, they understand that just because an object changes shape, that it doesn't mean that it's a different volume. So this is going to be like if you have like a glass of water and you have a really tall, skinny glass of water and you pour the water in, it rises to a higher level than a glass that's wider. And kids at this age group understand that the volume isn't determined just by how high it rises in the glasses. That's going to be in part determined by what the shape of the glass is. So they're starting to have this ability to conceptualize those concepts. So generally speaking, kids grow really fast when they're younger, and in this age group they start to slow down, so they actually get a little bit chubbier. They're kind of shorter and heavier, and then when they hit puberty they really go through a growth spurt where they grow taller. Their brain reaches this normal kind of adult size, and they're continuing to get more coordinated. So you can imagine in this age group, they're going to maybe start playing sports and stuff like that. We talked about the 6 and 6. So they're going to, start getting their adult teeth in when around 6. Their GI tract is going to grow. So they're going to have increased ability to eat sort of regular size meals. And when you're born, your heart's pretty big in proportion to your body. And that kind of changes where their heart is getting smaller in proportion to the rest of the body. Something that we need to remember is the size of a kid is not determine their level of emotional or intellectual maturity. So just because a kid is maybe big for his age, either overweight or tall, that doesn't really influence at all their cognitive abilities. So making sure you treat children based on their developmental age, not their size. So, just always when we're talking about development, there's a lot that is influenced by your environment and your parents, and that kind of includes your gender identity and your sense of sexual orientation. This is kind of getting back to having realistic goals, having them develop that sense of self-esteem, that sense of industry. So having realistic goals that they can meet, and exposing them to new things. So also remembering that really kids should be developing a sense of responsibility as they continue to grow. So homework is their responsibility, and they should have realistic goals for coming home and doing their homework and getting it done. And as the nurse, if you're like a school nurse, or parents say in the clinic that they're missing a lot of school or they're showing up late, these are all things that you should worry about. You should always be thinking about cues that there could be something going on at home that you need to intervene as a nurse. This just kind of goes into, you should try to speak the kids' language. If they're using a lot of slang or a lot of words that aren't part of your vocabulary, you should at least know what those words are. And remember that kids don't always know those words. They could be hearing these words from older kids. So kind of, if you're going to work with kids, you should speak their language. So this is just going to kind of continue to go through in the preschool years. We talked about like at 3, you can do this, at 4, you can do that. So we're going to go through kind of as how kids change as they go 6, 7, 8. So the main thing is that they're becoming more and more confident in their physical skills, and they're going to continue to have like an increase in their vocabulary. Something I want to point out is that they still need a lot of sleep. So, a 6-year-old should still be sleeping 11 to 13 hours a night. So this bedtime routine, you should still have a bedtime routine. You should be making sure they're going to bed on time and getting enough sleep, because they can't do well in school if they're not sleeping enough at night. We talked about this. They prefer to hang out with their same gender group. And even though most of the immunizations are when they're prior to going to school, you need to make sure that they're, getting their annual flu shot, they're getting their hepatitis shot when it's due, et cetera. There's still immunizations they get throughout childhood. So 7-year-olds are starting to continue to mature. This is really the age where they maybe develop more of a sense of humor, and they can set really high standards for themselves and really have high expectations. So you want to continue to make sure that you're having realistic expectations for your child so that they can learn that sense of accomplishment. This is kind of getting into Piaget. They're getting better and better at math. You know, when kids are little, they play, but they don't necessarily play sports. So active play is still important. It's becoming a little bit less important. Kids might like to do quiet things like read, etc. And then maybe they're going to also move from just active play in the neighborhood to actually like being on an organized sports team. 8-year-olds can be kind of bossy. They want to do everything. They think they know everything. And this hero worship is a concept that we talk about kind of late school age going into early adolescence, where they really fixate on a celebrity and really want to be like that person, like Katy Perry or some really famous athlete or something like that. So this kind of starts maybe 8, 9, 10. So we're talking about, you know, being on a soccer team or being on a baseball team or whatever. They really, by the time they're kind of well into the school age years, heading into like pre-adolescence, they're really able to play competitive sports. And that's good, but you also need to make sure that you're teaching them appropriate anger management and how to resolve conflicts without violence. As they continue to go older, they're going to be more interested in family activities. They're going to have the cognitive ability to really play board games. They might think that's something that's fun to do in their family. And they're also going to be less sensitive to a little bit of criticism. So you can start to give them some constructive feedback, and they should take it better as they continue to grow older. So, you know, they're needing a little bit less sleep by the time they're 9. So we're down from 11 to 13 to 10 hours, but still 10 hours is quite a bit of sleep a night. They should still be getting their permanent teeth in. And as they continue to play sports, thinking about making sure they have like the appropriate padding, helmets, etc. So we're going to do adolescence after our break, but something to really think about with adolescence is that, you know, puberty is happening younger, especially in girls. So you can see signs of puberty, signs of hormonal shifts and stuff like that as young as age 10. So just being aware of that when you're working with kids. You know, 10 might seem really young, but there are some girls that are starting their period around 10. So just to have that in your mind that they can start these hormonal changes. When you get to that 11 to 12-year-old, this is going to be getting into some of those preteen years. They might start showing an interest in opposite genders, or maybe wanting to spend time with other people. That peer group becoming more and more important. You know, as their hormones start to kick in, they have less of ability to concentrate, and they might have a lot of questions about how and why their body is changing. And this is just all like coming like pre-adolescence coming for the big hormonal changes. At this point in time, they have the cognition that they can understand why parents make rules. So instead of just saying, you know, you're grounded, you should be like, you're grounded because of this, and this is the consequences of this decision that you made. So you can start to have, as a parent, you can start to have more in-depth conversations, and also recognizing, you know, nobody does well with nagging. So you should have like rules, like you have to empty the dishwasher after dinner, and then there's a specific consequence for that rule, and then you follow through. So the consequence could be that you can't use your iPad if you don't unload the dishwasher. And it's not a fight. You just like, you didn't unload the dishwasher, so now I am taking away your iPad and you can have it back tomorrow. And you have those rules, and they're able to understand why there are rules and why there are consequences. And they're certainly able to do chores at this age, and you can kind of use them doing chores and helping out with the family as part of your discipline and your teaching them about consequences for their behavior. So you still need to be making sure you're doing the vision and hearing screening like we do it all throughout childhood. So just because they've done well on their screenings in the past doesn't mean they don't won't have a problem now. If kids can't learn, if they're not able to see the board, if they're not hearing well, etc., you should also start thinking about doing like scoliosis screening as girls head in towards adolescence. So another thing that you could do as a parent is to start thinking about having an allowance. This is part of, a good way to teach kids the importance of responsibility and how hard work can help them earn money, etc. So if you have that, ability, kids generally speaking enjoy actually doing chores and they like having responsibility. If there's a financial board, that helps them learn that concept also. So that is the end of the school age. Do you guys have any questions? No. Okay, so I'm going to give you a 10-minute break. So go ahead and come back at, I got to look at my clock here, at 10 a.m. And then we'll do adolescence, okay? Okay, everyone, welcome back to class. We're going to go ahead and get started. I see people joining us. Thanks for coming back after your 10-minute break. Okay, so hopefully everyone can see my screen. You should see the adolescent PowerPoint. So we're going to go ahead and talk about adolescence. So the main thing, I think we all know, this is when we really start to develop sexually. So appearance of secondary sex characteristics. By the time you're done with adolescence, you've really reached your adult height and you have a lot of the thought processes and emotional maturity of an adult. We generally divide it into early, middle, and late. So you know, I've gone through and asked you, so I'm going to go ahead and ask you again. So what is Erickson's stage for adolescence? Where are they?
Ooh,
What is their task?
Identity versus role.
identity and role.
Very good. Identity versus role confusion. So this is where they're really starting to develop that sense of independence. They're also probably having romantic relationships. So there's certain things that you need to think about. They're very, very concerned about privacy. So you want to make sure that you're respecting their privacy whenever you're talking with them. Really open communication, open-ended questions, establishing rapport before you start asking them any personal questions. And then recognizing that adolescence is a stressful time. There's a lot going on, and they might need help with coping with that stress. It's normal for adolescents to not get along with their parents. So you need to be kind of preparing parents and adolescents for that. Their hormonal drives can really make them have very, very intense emotions and desires. And part of their developmental process is to have a really strong peer group, and that peer group really influences a lot how they feel about themselves and how they feel about life. So very good. This is your identity versus role confusion. For Piaget, this is where they really start developing abstract reasoning. So, you know, concrete reasoning is the school-age child. Adolescent for Piaget is abstract reasoning. And then Freud is the genital stage. This is where they're really focused on their sexual desires. So, you know, girls usually begin adolescence, puberty a little bit before boys. Girls around age 10 up to age 13 is normal for them to start periods or start really going into adolescence. This is just kind of going over all of the different physiological changes that happen when you're an adolescent. So even though we talk a lot about milestones, et cetera, it's also important to remember that age of puberty varies. So not, you know, even within the same family, not two kids are going to be exactly the same. And it does tend to occur early in girls than it does in boys. And they are still gaining weight and they're still growing taller. Part of their weight gain, even if they don't look like they're bigger, is they're having an increase in their skeletal muscle mass. And they should always go through a growth spurt. So usually in their teenage years, you're going to really see them start to grow taller. They tend to be kind of awkward, long-legged, acne, oily skin, oily hair. Those are normal things, and just to be able to help them prepare for that. So I think that we kind of generally understand, you know, it's not just height, there's also hair development, shoulders widen. So boys and girls, there's something called Tanner staging that I'm going to go ahead and flip to here. So Tanner staging is, you know, 1 through 4, with 1 being no signs of development and 4 being a fully developed and from your sexual characteristics. And this breaks it down. So stage 1 is no sexual development for boys and girls. And then stage 2 is the first stage where you really start to see changes. So the first thing for boys is testicular enlargement or testes enlarging, and they start to sweat more. And then girls, you're going to see breast budding, start a little bit of pubic hair. So certainly you need to be aware of Tanner staging to recognize that it's like a standardized tool to gauge where somebody is in their sexual development. And you also need to be aware that the first thing that you see in boys is testes enlargement, and the first thing that you see in girls are breast budding. And this is just showing you the pictures. So this is a breast bud. It's not like really a full breast, but you're seeing it starting to bud out. So you need to remember those, what Tanner staging is, and what, stage 1 is none, and then stage 2, the beginning of development, boys is cystic enlargement, and girls is breastfeeding. So, and when you document, if you're assessing an adolescent, you can always put their Tanner stage in. That's helpful in terms of documenting where they are in their sexual maturation. So the main sort of psychosocial thing that adolescents are going through is that sense of identity, and then, intimacy is starting, but the main thing is that sense of identity. So it's normal for adolescents to try on different identities. They might be like into punk rock when they're 15, and then by the time they're 17, they're really into jazz. Like, they try on different identities, and they might change their peer groups, and whoever is in their peer group really influences what they're into at that period of time. They also need to practice making decisions. So they need to be able to make mistakes. It's a really, really hard time to be a parent, because you want to give them a little bit of freedom to make decisions and make mistakes and learn from those mistakes. But at the same time, they have like this sense of invincibility, and they don't think bad things are going to happen to them. So then they tend to have poor decision-making skills. So there's really a fine balance of like giving them the space to learn, and also still trying to provide boundaries so they don't, do something really stupid. So always considering their cultural and spiritual, are they Muslim? Are they Jewish? Do they have any specific issues with their culture that could influence their identity that you need to be aware of? And just also to be aware of, it's normal for them to think that everyone's looking at them. They tend to be very self-conscious and very concerned with their body appearance. So I think if you've ever known a teenager, you know that whatever their peer group is really important to them. So as a parent, you want to be aware of who their peer group is, and what sorts of activities their peer group is doing, because that's going to very heavily influence what your teen is up to. So for Piaget, this is your formal operations. What can you say about what, according to Piaget, what is the main thing that adolescents really, that's different than an adolescent from, say, like a school age child? What is different about their thinking?
They have the ability to think abstractly.
They have the ability to think abstractly. Very good. So the school age child, according to Piaget, is concrete. So they're very linear, very logical. They don't really have abstract thought. Whereas adolescents, they can think abstractly. They really understand the concept of cause and effect. So this is the formal operation stage. So by the time they're, we talked about adolescence, we divide into early, middle, and late. So a late adolescent, 17, 18-year-old, they have more empathy, they have more sympathy, they can see situations from multiple viewpoint. They really, abstract thinking is common for them, and they are starting to have like that advanced moral compass that Kohlberg talked about. So obviously a major part of adolescence is starting to date. And, you need to be aware of, obviously dating can lead to sex, which can lead to pregnancy, that lead to sexually transmitted infections. So I'd love to hear your thoughts. Do you think that public schools should teach sex education? And if so, what do you think they should teach?
Yes.
Yes.
Okay. Yes. Does anyone think no, that public schools should avoid sex education?
No.
I don't think they should avoid it, but I think that they should give the parents the opportunity to present that to their children first. All kids don't advance at the same age.
Okay.
And
Yes.
sometimes when
But some
they expose them to that type of stuff at school, it can like really be shock on them. Yeah.
Okay.
But
Okay,
some
that's
parents,
fair.
but some parents have a problem addressing those type
Mhm.
of I say subjects with their children. It depends on the environment overall, religion, a lot of stuff takes a factor in that. And I feel like at that age, children are very curious. I have adults, so I understand that part, and I have teenagers in my home now. So I do understand. And if you don't I mean, I believe you should bring it to them. I feel like you should have an opportunity, but all the time that opportunity and that presentation, because it wasn't presented to me. So, I mean, my parents shied away from it. I learned in the streets, and I feel
Okay.
like that's the wrong place to learn about sex.
But I
Yeah,
think we've
okay.
also had a generational shift with that too.
Yeah.
I have children from my youngest is 8, my oldest is
Mhm.
23.
Oh,
Yeah.
okay.
The conversations that I had with my 23 and my 21-year-old, or I'm sorry, that I didn't have with them, I now have with my 8 and my 12-year-old.
Oh,
Correct.
okay.
I'm more comfortable now.
Yes.
More
Me
things of
too.
things are more accepting. So
Mhm.
Mhm. Yeah,
Me
I
I
agree
think
too.
that
that as
society
we
has changed. Yeah, yeah,
Yes.
yeah. And so, let's see here. So, Lenise, do you think that because you're talking to your 8 and your 12-year-old, they're more likely to have sex, or do you think they're less likely to have sex?
I think they're less likely.
Okay.
I have a 21-year-old daughter too. And I
Okay.
talk to her. I talk to her a lot. She was very open with me. She was allowed to have boyfriends. She was allowed to date. Boyfriends were allowed to come over. We had a really open relationship, and like I said, she's 21 now. She doesn't have any children. She has a
Hmm.
very successful career, lives on her own, but we created that channel of communication. And
Okay.
that's it's important.
It's
Yeah.
important.
Yeah, having that channel of communication is really important, but it's
Mhm.
also important as a nurse to recognize they might come from a religion that really does not want that to be discussed. So I understand the point of view that maybe parents should have the option to opt out, that they're going to
Mhm.
offer this
They
class
they
at
do
school.
though. They
They
do
do.
though. When they do the sex education class, they actually send the child home with a permission slip that the parent has to sign that they're okay with their child taking it. And if
Okay.
they don't come back with it, then the child can't take the sex education class.
Okay.
Okay.
So, I'm putting that out there just for you guys to be thinking about it and to sort of be aware that it is kind of a hot topic. It doesn't, well, sometimes people believe that if you offer sex education, it makes it more likely for teenagers to have sex. And the
Mm-mm.
evidence doesn't really support that. So just so
It
you know, I
doesn't.
mean, you're allowed to have whatever opinion. I respect everyone's opinion, but
Mhm.
like looking at group data, children that are exposed to information about sex are not more likely to have sex.
I
And I
agree.
would also say, as a nurse, you need to know what the rules are for your state. So some states allow like 15-year-olds to get birth control without their parents' permission, and some states you have to be 18. So if you're going to be practicing somewhere where kids could potentially be asking you about birth control or getting tested for sexually transmitted infections, you really need to know the laws of your state because they can vary from state to state.
Mhm.
So, you should, I think it was Latrice that said that, having that open line of communication or Lenise, I'm sorry, that having that is really, really important so that they trust you and then they'll come to you and they'll have that conversation with you.
Agree.
So having open-ended conversations, being non-judgmental, letting them know that you're a safe place that they can come and talk to you. And not just talking about birth control. Like obviously the only way to prevent pregnancy 100% of the time is to not have sex. So making sure that abstinence is also something that you put on the table as something that's an option. Um, this is kind of getting into this information that like just because you talk about sex doesn't mean that kids are more likely to have sex. So and then they mentioned homosexuality in here, and I just want to point out I'm aware of the fact that the theories are pretty outdated, and they kind of like always talk about opposite gender attraction. I think that we can probably agree that people when they're adolescents, they probably know what their sexual orientation is, and being open to that and not being judgmental, and also being aware that they also experiment. Just because someone dates somebody from the same gender when they're 14 doesn't mean that they're going to grow up to be gay, but it doesn't
That's
mean that
right.
they won't. So just
That's
to
right.
be aware of that.
Mhm.
Um, so sometimes adolescents don't want to go to their parents. So if they have a school nurse or a nurse that they trust where they can talk about their fears, they need to be able to talk about their fears so that they can start planning for what might happen. Sometimes adolescents daydream a lot. That's normal. They're actually thinking about problems and thinking about possible solutions. So at this stage, they really have the cognitive ability to understand cause and effect and to problem solve, but they need that safe space where they can really talk about their fears. Um, Obviously, we need to be concerned about adolescents that are acting like they're depressed, suicidal, engaging in risky behavior. So kind of being on the outlook for kids that are on the computer too much, maybe are too involved with social media, and aware of the effects that that could have on their life. So nutrition, we talk about nutrition a lot when kids are really growing quickly in adolescence. You're more likely to kind of get into eating disorders or skipping meals or like experimenting with vegetarianism, etc. So to be aware of that, and also kind of the same thing, if someone tells you that they're going to be a vegetarian and instead of telling them that's a bad idea, make sure they know where to go
The
to
right
get the
thing.
nutrients that they're going to be missing if they're not eating meat. So they're most likely to be missing calcium, iron, and vitamin B12. So calcium is going to be from your milk products, and your iron and vitamin B12 from your meat products. So it's not unusual to experiment with vegetarianism when you're a teenager. You need to make sure if they're participating in sports that you're giving them good information about the nutrition that they need. Things like caffeine and alcohol can, make you get dehydrated. It can be dangerous if you're really doing a lot of sports. Also, you don't want anyone, taking steroids or anything like that. Still talking about, hygiene. They're sweating more, they have oily skin, oily hair. They need to be still taking care of their teeth. Sunbathing is still a risk. At this age, they should really be responsible for putting their own sunblock on. They need protection with sunglasses also. So I always point out here so in your textbook, it says that motor vehicle accidents are the leading cause of death in adolescents. I'm going to just say that I'm aware that it's gun violence is the leading cause of death now in the United States. But if you're ever asked this on a test, go with what your textbook says. So I want to acknowledge the gun violence crisis that we have in our country, but your textbook still talks about accidents. So
Yes.
if you ever asked, it is accidents, not gun violence. So there's something very, very specific to adolescents that we talk about is the female athlete triad. So this is going to be your female that's very, very competitive in sports, and also as part of that is having some disordered eating, most likely something like anorexia, where they're not really eating enough. So they can have this not adequate food consumption, and this can lead to them stopping their period, so amenorrhea, and then also osteoporosis. So just to be aware, there are eating disorders in teenage boys also. It's much more common in girls. So to be on the lookout, if, sometimes it can be someone that looks healthy, they're muscular and fit, but they're still on that eating disorder spectrum, and it can have really long-term consequences. So, education is super important. We talked about sex education, also drug education, drug and alcohol. Teenagers are going to have access to whatever they want. If they're going to a public school, they can buy any drug that they want. So to be aware of that, and to be aware of the peer pressure and the pressure from their classmates can really influence whether or not they experiment with drugs. So this acronym, this PACE acronym, parents, peers, pot, alcohol, automobiles, cigarettes, education. So these are sort of things that you should be asking about. What is the relationship like with their parents? What type of peer group are they on? Are they smoking pot? If they say two things that make you think that they're kind of at risk for risky behavior, then you should be considering, maybe counseling or other therapies, other interventions for the potential of drug use. So the main thing is to know as a nurse that it's out there. If you're a teenager, you're going to be exposed to drugs and alcohol, and they need a safe space where they can go and talk about it and be on the lookout. They can certainly have addiction problems and problems with drug and alcohol even at a young age. We talk about depression more in this age group also, and I think now, kind of coming out of the COVID pandemic and the schools that were shut down, et cetera, there's just a lot more emphasis being placed on depression. So it happens in adolescence probably more often than in other age groups because of all those fluctuating hormones. So it can be related to drug use. Also, sometimes people's personality really changes when they start using drugs. So to be on the lookout for this and to always be cognizant, you know, if someone mentions suicide, you need to take them seriously. So, you know, hopefully we have school nurses around that are able to recognize the depression, try to have that open communication, make sure that adolescents have access to hotlines at this age they can call and ask for help from themselves, and try to help with coping mechanisms and getting them into counseling if needed. So obviously, if kids are having sex, they can get pregnant. So supporting the mom, supporting the baby, making sure they have enough nutrition, referrals to services to help with housing, healthcare, etc. And, you know, having an open mind. Sometimes first they're kind of shocked that they're pregnant, and then they really focus on the fact that they are pregnant, and then it's not really till they're about ready to have the baby till they're really sort of planning about how that's going to affect their life. So there's a lot of teaching for adolescents: nutrition, dental care, personal care, body person care, accident prevention, substance abuse, self-control, risk-taking behavior, money and time management. All of these things go into working with an adolescent. So these are just some funny quotes. Mothers of teenage girls know why animals eat their young. So I think it's probably the most complicated time to be a parent. So I applaud all of you out there who have, you know, successfully raised kids and are doing well in life, because it is really, really challenging to be the parent of a teenager. Do you guys have any questions or comments that you want to add before we do the Kahoot? Okay, so I'm going to go ahead and pull up the Kahoot. So the plan is I'll pull up the Kahoot, and then you guys will take a break. And when you come back from your break, you'll take your quiz. And when the quiz is over, you're free to log off of Zoom and be done with class. So let me find it for you.
Professor, I wasn't able to do the Kahoot on my own because it said that there were too many people.
Was that the Kahoot for week 1, or when was it?
Yeah, the one for week 1, but I was never able to do that one because it said there were too many people.
Okay, I'll look into it to make sure. Thank you for letting me know. I'll go in and make sure that I have it set up so that you can do it. Thank you for letting me know.
You're welcome.
Okay, I'm gonna go ahead and get started. So a preschool child is asked, why do trees have leaves? Which response would be example of animism? Because God made them that way, so I can have shade over my sandbox to hide behind when they are scared, or for the squirrels to play in. All right, so very good. So animism is that, giving non-human characteristic or human characteristics to things that are not human. So if they're hiding behind their leaves, that's a human characteristic. So it's the blue one, because God made them that way, so we can have shade over my sandbox for the squirrels to play in. That's not really getting into the concept that they give human characteristics to things that are not human.
Professor Kenny, never mind.
No, okay. What task would be appropriate to expect for a 5-year-old child? Carrying glasses from the table to the sink, scrubbing out the sink with cleanser, washing the dirty knives, or setting the table with paper plates.
This one.
So very good. Yeah, so they like to do chores, but it has to be something that's safe to do. So the best thing would be setting that table with paper plates. So a father is concerned about how long his preschool age child will continue sucking his thumb. What is the best response from the nurse? Place liquid thumb on to make it taste bad, distract the child whenever he sucks the thumb. Thumb sucking can cause damage to teeth, so it must be stopped right now, or most children will stop thumb sucking naturally by school age. Yeah, very good. Yeah, so most of the time they just, you don't need to worry about it. Most of the time they'll stop. You can do some positive reinforcement if they're trying to stop. So what should the nurse suggest is the most appropriate toy for a 3-year-old? A small pet like a goldfish, a large construction set, a board game, or a push-pull top?
This one.
So very good. Oh, there's a couple. So push pull would be more like a 2-year-old. So by the time they're 3, they're probably going to be getting into some like associative play. They like to build things. So 3-year-old, this push pull is probably a little bit younger. So the large construction set with big blocks where they can build things. So what fear is unique to the preschool period? Death, water, bodily harm, or animals? Very good. So it's bodily harm. They're really worried that, if they get injured, that it's going to be like an amputation. They're very worried about harm to their body that's really specific to that age group. So when planning an activity for a 3-year-old, the nurse bases the plan on what attention span? So they can sit still for 10 minutes, 15 minutes, 5 minutes, or 20 minutes.
Minutes.
Yeah, so several of you got this right. So I think 15 minutes is really the maximum. So they can't really sit there for that long, but you should be able to expect them to do an activity for about 15 minutes. So a 4-year-old insists he has more money with a nickel than his father has with a dime. According to Piaget, why is that true? Because of intuition, egocentrism, animism, or artificialism?
Industrial. Spread.
Okay, so one of you, very good. So which one is bigger, a nickel or a dime? Like if you look at the coin, which one is bigger?
The nickel.
The nickel. So intuition is that you see two things and you're going to think the one that's bigger has more value. So like a kid that doesn't really understand money or doesn't really have math skills, etc., will look at the bigger coin and insist that one is bigger, it's worth more because it's bigger. So that is intuition per Piaget, which is still they're in that preconceptual, they don't really understand math yet. So what should the nurse keep in mind when planning to teach a class on nutrition to 4th grade students? School-age children can think abstractly. School-age children are egocentric in their thinking. School-age children think logically and concretely, or school-age children can only concentrate on one aspect of a situation. All right, so one of you, so this is going to be the concrete. So I would say if you're thinking about new cognition and you're a school age, if it says concrete in there, I would choose that answer. So this is the concrete operation stage according to Piaget. They're very logical and concrete. A couple of you were drawn to this. They can concretely concentrate on only one aspect of a situation. They're very concrete, but you might be able to explain multiple situations to them. They're not really into abstract thinking yet, but they're starting to expand how they think. So an 8-year-old child has frequent nightmares and the parents are concerned. What is the nurse's best response? They are an abnormal response to repressed feelings. They are a side effect of overactivity and stimulation. They are a common result of latent sexuality, or they are normal extension of the child's fear of mutilation. All right, so a couple of you, I bet a couple of you that were parents. So kids pretty frequently have nightmares. So you need to be aware of the fact that they happen, and it's not necessarily because something bad happened. It can be just like their normal fear of what's happening in their life, and that gets expressed in their nightmares. And they start with bodily harm, and they kind of continue with this fear of mutilation in this school age years. So this is the best answer. It's kind of a normal extension of their fear of mutilation. So a 10-year-old girl likes school, plays the flute, and plays tennis. What do these activities help develop? Industry, identity, intimacy, or initiative? All right, so this one is a little bit tricky. So your 10-year-old, this is going to be your school age. And you should be able to recognize that some of these words, they're popping out as you as part of Erickson's theory. So the 10-year-old is going to be in that industry versus inferiority. So having her do these things helps her develop this sense of industry. This is getting to Erickson's theory for this age group. That would be the best answer for a 10-year-old. So what statement by an 11-year-old child leaves the nurse determined that he has moved from the mindset of egocentrism? So he's no longer egocentric. I must do my homework before I can play. I'm a member of the best Cub Scout group in the world. I'm sorry, I bet that hurt your feelings. My dad can do anything. So very good. So if they're sorry and they're thinking about somebody else, they're no longer being egocentric. These other ones here, the kid is still talking about himself. My homework, my Cub Scout group, my dad, this is still like an egocentric kid, but somebody that's thinking about somebody else's feelings, they're moving away from egocentrism. So the school nurse is preserving a tooth that was knocked out. What will the nurse do? Place the tooth in a warm environment, wrap the tooth loosely in a clean cloth, hold the tooth by the crown only, or rinse the tooth with alcohol. All right, so we didn't talk about it, but it is in your book and it's on your test one. So you put the milk in, you put the tooth in milk. If you put it in something, you put it in a glass of milk. So you don't want it to be warm, it'd be a cool glass of milk. You don't want to rinse it with alcohol. And then the crown is not the root. So you're going to hold it by the crown. That's the best thing for you to do. And if you're ever asked, you should put a tooth that's been knocked out in a glass of milk. The nurse is assessing a 13-year-old boy, which physical change indicates male puberty has begun. Enlargement of the testicles, enlargement of the penis, development of axillary and facial hair, or pigmentation of the scrotum. So very good. Enlargement of the testes. And what's the first thing that you see in girls? Stage 2 for girls? For
Breast
Tanner?
Buds.
Breast buds. Very good. So remember both of those for sure, okay? So a parent comments that her adolescent daughter is daydreaming a lot. What does this behavior indicate? That she's bored, she's trying to block out stress and anxiety, she's not getting enough rest, or she's mentally preparing for real situations. So good. Daydreaming is normal and it kind of helps them plan and solve problems. So just to, be aware of this, something a very normal thing for adolescents to do, and it helps them problem solve and prepare for real situations. So the nurse is planning care for an adolescent. What psychosocial task is the most important for the adolescent? A sense of industry, a sense of initiative, a sense of involvement, or a sense of identity? So very good. This is back to Erickson's theory. So their stage is this identity versus role confusion when they're in adolescence. So the most important thing for them to really do is develop that sense of identity. Okay. So I'm going to actually skip this one because there's virtually no chance. We didn't talk about it at all. So I'm going to go ahead and skip it. Okay, last one. A girl tells the nurse, I love Katy Perry and I want to be a singer. This statement is typical of what age or stage? Middle adolescence, the entire adolescent period, late adolescence, or early adolescence? All right, so early adolescence, this is this hero worship. So this kind of starts end of school age, heading into adolescence. That's sort of like one person that they really focus on that they really want to be like. All right, podium time. Chan, very good. Kerr, I don't know who Kerr is. And Licia. All right, very good, you guys. So I'll put the Kahoot with the video announcement. It might be tomorrow morning, but I'll put the announcement up within 24 hours. And then I'll look in. Did anyone else have a hard time playing the week 1 Kahoot?
I did. I couldn't do it at all.
So what happened when you did it? Can you let me know?
Same thing. Too many people, it wouldn't let me in.
Okay, so you got an error message that said too many people had tried to play the game or something, or were there too many people logged in at that time? Okay, I'll go in and take a look. Thank you guys for letting me know. So that wraps up the week 2 information. Does anyone have any questions? Okay, so go ahead and take your second 10-minute break. So try to come back at 10:55. And when you come back at 10:55, I'll have your quiz on and you'll be able to take your quiz. Okay? All right, I'll see you guys in 10 minutes.